As we age, our risk goes high. Anybody who's less than 50 years of age, the risk of having a fracture after a fall is around 2%, which increased to more than 25% risk when they are above 65. So you can imagine the risk goes very high as we age. Other risk factors could be sex or gender, they say, which is female and male. Females have a higher risk. And then medications, underlying conditions, as well as steroid use for any given reason.
Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Asghar Bhaiyo. He is a consultant of stroke medicine and elderly care. Welcome, Dr. Asghar Bhaiyo, to Faith and Discipline podcast.
Assalamu alaikum. Thanks for having me back.
Our first question is, what are the risk factors associated with bone health?
Okay, very interesting topic here, especially in this country or in aging population. The biggest risk factor is, to be working with you, old age. As we age, our risk goes high. Anybody who's less than 50 years of age, the risk of having a fracture after a fall is around 2%, which increased to more than 25% risk when they are above 65. So you can imagine the risk goes very high as we age. Other risk factors could be sex or gender, they say, which is female and male. Females have a higher risk. And then medications, underlying conditions, as well as steroid use for any given reason. For example, if somebody is using steroid for chronic obstructive pulmonary disease or rheumatoid arthritis or other diseases, they may use steroids for long term. These are all risk factors in causing people to have weak bones or osteoporosis.
Is there any role of other things, like dietary things like salt or caffeine to link to the bone health?
To my knowledge, not directly, but indirectly, yes. Obviously, if we don't have a healthy diet, for example, if we don't take much milk or any dairy products which are high in calcium, so you may be predisposing yourself to low calcium levels or vitamin D levels, which may predispose to osteoporosis or weak bones. At the same time, absorption of calcium, this is also important. So tea and coffee, they say, they do affect absorption also.
You know, women, when they go through menopause, I think that's the age when they start having weaker bones. So what is the link?
So the direct link is, the indirect link is the hormones of women play a role. When they go into menopause, the hormonal changes make changes in their bone density and everything. That's the link which make them a bit vulnerable to fractures or osteoporosis, because the hormones which are helping them out are suddenly changed to something different. That's why, for example, male testosterone levels and everything, they help the bones to go stronger. Females do the opposite side.
Right. So you mentioned COPD, but some patients, they take clinal inhaler for their asthma. So does that also play a role in
any steroid containing medications? It could be an inhaler, could be tablets, could be creams, which absorption is there, predisposes yourself to high risk of osteoporosis or bone weakening.
Okay. So what is your suggestion? What they need to do if they're taking steroid regularly? Obviously they can't stop it because of other ailments. Do they need to take additional calcium with it, or what do they need to do?
Again, goes back to risk factor assessment. So NHS guidelines are quite clear. So if there is a scoring system called FRAX, which is FRAX or Q fracture, you can do a fracture scoring system to see where your risk stands. The guideline again gives you quite a clear indication which patients should be screened and what should they be done and what treatment should be offered. So if somebody is taking steroids, as you just mentioned, so you should be screened at least 5 yearly, especially when they're above 40. So every 5 years they should have this screen to see where they stand.
Okay. Well, you know, some kids, they develop asthma at a very younger age and then they keep taking inhaler for the rest of their life. So at what stage do you reckon it may cause a big problem?
I think if you look at the asthma directly, it depends on how you see the child. So if I'm honest, most of the children who have asthma childhood, they grow out of it. Some of them do continue to have it. So whoever is on a long-term use of steroids of any kind should be screened for it. For example, if they are using their inhalers a lot, or they're using steroids a lot to control their asthma, then they will be more predisposed themselves to a risk of weakening of bones because of steroid use. So they should be screened. Now, question comes in, how, when do we? So our screening system just mentioned fracture and Q fracture. Takes this score, they can be done at the age of 18 years also. So 18 years onwards, this score can be used.
Okay. So did you say every 5 years?
Ideally, yes, because depends on the first score. So, for example, if they continue to use steroids, they should be screened every 5 years.
Okay. When we talk about bone health, the thing that comes to our mind is calcium. So what is the link of calcium and vitamin D with the bone health?
Calcium and vitamin D are very vital minerals, or say vitamins, to maintain bone health. So calcium is needed for strengthening the bones. Bones normally is made up of matrix of two types. So obviously calcium and phosphorus or phosphate plays a role. So they are the building blocks in a way, if I say so in a layman term. So they are needed for strong bones. Similarly, other vitamins also needed, including vitamin D. So vitamin D and calcium play together to make our bones strong, and that's why both are needed to make for a healthy bone growth as well as structure.
So majority of people, they only relate calcium and vitamin D to bone health, but there are some other minerals which are also important. Do you reckon everyone need to take healthy diet like phosphorus and magnesium and things like that?
Definitely. A healthy diet, there is no substitute to that, if I say so, with less side effects. Obviously, every medication comes with some sort of a side effect. So if we take a healthy diet, which should include what they call as dairy products, which is milk, butter, cheese, they are high in calcium as well as vitamin D. So they will help with the phosphate also, and then for healthy bones.
When you said like calcium and vitamin D, they are important, but there are some news in the media taking too much of vitamin D can cause poisoning of vitamin D, and also if you have too much calcium in your body, then it can cause kidney issues and things like that. Do you reckon is that the case?
Well, I think if we start with calcium, we need to be very careful when we are assessing calcium. Hypercalcemia, which is high calcium, can be due to different reasons. It is rarely due to overdosing of medications, but other disease processes need to be sought out. For example, multiple myeloma or other bone diseases or metastasis. That's the most common reason of calcium being high. Other disease processes like other malignancies for parathyroid can also push the calcium high. So I think depending on the age and the risk factors, it has to be assessed, and then we can say. In terms of, I've seen cases, especially the elderly people who keep on taking Adkel D3, which is a calcium tablet, and then they come with high calcium levels because either they are dehydrated or they're taking too much without anything else. So it has happened, and in many cases we do stop them. Hypercalcemia in itself can cause confusion, can cause constipation, can cause abdominal pains, and can cause stones also. So yes, there's a risk factor, but rarely happens with medications. It's mostly the disease process.
So it's always recommended to consult your GP before taking any over-the-counter.
Definitely. I think again the problem, or we should say, or as advice is, don't overdo things. Let's do it this way. So I think once you think that your diet is not good enough, and especially in countries like England or UK where you have less sunlight, and then you stay indoors most of the time, the risk goes high, because vitamin D is essential to for the metabolism of calcium and pushing it into the bones. So if you have less vitamin D levels, then you're prone to have low calcium levels, and then it leads to weakened bones.
Do our genes determine the size and strength of our bones that make up our skeleton?
Definitely. I would say there are two things I would say to this. One is the normal genes, and then the two is abnormal genes. For example, if you look at the statures of, let's say, Oriental people, normally they don't have a very tall stature. But if you go for Northern European people, they have a long or a tall stature. So definitely genes play a role in their in their bone strength as well as the lengthening of it. Now, about abnormal genes, some disease processes they may predispose you to for weakened bones. For example, Down syndrome or any other malabsorption syndromes will make you vulnerable to weakened bones because again the exposure is less, and then you are more prone to have osteoporosis later in life.
So when you mention about malnutrition, it's like colic disease or any of the disease of liver and gastrointestinal problems?
Yes, definitely. So that's why I said about the FracSys score. So this is scoring system which is developed by the Sheffield University is very good because in one of them is gives you an idea of a secondary osteoporosis. So secondary osteoporosis are the all things which might contribute. So they are not directly contributing, but because of the disease condition. For example, as you mentioned, celiac disease where there's malabsorption, similarly other disease processes. Again, people living in poor conditions may not be exposed to good diet. Again, sunlight is important. So these are all reasons for osteoporosis.
We talked about like medication and food, but what is the link of exercise?
Again, I think there have been so many studies done, especially in the elderly people. People who exercise live a longer and healthy life. So again, as you can understand, for us to have a healthy life, we need to have a good body, which includes muscles as well as bones. So bones are the main structure which makes us stand straight, walk around, because they are the one where muscles are attached. So we need the strong bones to have a strong body. So that's why there's a direct link in that way. So healthy diet, exercise helps you keep healthy as well as going for a longer time.
And when people become older, they have things like their bones become weaker, which called osteoporosis. So what is the treatment option for them? Because obviously they can't do much exercise, and then diet wise they start taking less and less food and might not take all the minerals and vitamins. So what is the treatment option for them?
I would say you have to do it in an individual basis. So you need to assess the patient first or the person first, what exactly they can do, how much can they do, and then depending on their risk factors, you can adjust the medications as well as you can provide them with medication. So mostly there are two options as most common. One is the calcium supplement, the other along with that is the vitamin D supplement, and then there is bisphosphonates which help strengthening the bones. Now vitamin D level is very, very important to check before starting bisphosphonates. If they are low, the risk of fractures goes high even if you go for the bisphosphonates. So you need to make sure they're adequate in calcium as well as vitamin D before starting them on bisphosphonates. So you need to do these tests first before starting any medication.
I want to focus on pelvis area. Although bones in our body, almost all of them are very important for us to do a daily function. But pelvis area bones, they are very important for like a lot of movements, sitting, standing, walking. So why do these bones fracture in elderly patients?
I think if I'm honest, we do when we do the scoring system, it does gives you pelvic bones. Before I start on pelvic bones, I can just say people who have low trauma, for example, which is fall from a standing position, sometimes they break their wrists, or if they complain of back pain, which is highly indicative that bones are weak. So they should be picked up early and treated early, so then to prevent any pelvic bone fractures. The one which you are mentioning, I think you're talking about neck of femur. That's a very important bone to keep us straight. Without that, you can't walk around properly, or you may become bed bound or wheelchair bound. That's why people focus more on that. So that is one of the strong bones, but if it becomes weak, any small trauma can make it fracture, and then you have to go through surgery and other things. So it's better to, as a risk factor, if you catch or if you do risk assessment and treat, you may prevent this.
Because in general public, we have observed elderly people, when they fall, majority of it is the pelvis area bones, they break it, and then they're bedbound for the rest of their life. So from that point of view, I asked the question.
Yeah. So one of the weakest point is the neck of femur. So because the whole body is resting on it, so you can see it's quite a high impact, or there's a lot of pressure on it. So that's why if any small or any trauma may cause it to break very easily. That's why it's the most common site for break after falls.
Okay. Do you know which people are more prone to have falls, and how we can prevent that?
Again, old age makes you what we call is sarcopenic, which is our muscle strength, our muscle mass, our bone mass has gone down, so they become weak. So they are more prone to falls with small trips and slips. Similarly, any other condition which makes our joint stiff, for example, any arthritis, rheumatoid arthritis, osteoarthritis, makes the joint stiff, then we are more prone to falls. Any other condition which impacts our mobility, for example, is strokes, seizures, we are more vulnerable for falls. So those are people we need to concentrate on to make sure they have their bone health assessment done and treated accordingly.
We talked about bones, but ligaments and tendons are also important. So how can we protect that?
Again, I mean, if you look at the strengthening exercises, that's the main thing. So again, as you mentioned earlier, exercise is very important. So when you are doing, our structure is made of bones and muscles. So muscles are attached to bones through tendons. So all three play a part together. So if the bones are strong, then you have got a strong anchorage. So then you need to do exercises to keep your muscles going and keep your muscle mass up.
So what is your recommendation? What can we do to prevent the wear and tear of bones as we age?
Again, I think regular exercise is very important. Healthy diet is very important. Taking supplements is important. At any point, again, this all depends on the risk assessment. As we are aging, our diets go down, our exercises go down. That's why people should be encouraged to walk around, maybe brisk walking, jogging, joining a gym, or passive exercises, even swimming, which is to help with the back muscles. They are all recommended, highly recommended, I would say, for keeping a healthy life as well as strong bones and muscles.
So healthy lifestyle and healthy diet is the key.
No alternative to that.
Right. Okay. We mentioned diet here, but a lot of people, they are moving away from dairy. There is a quite bad media about dairy products, and people are moving away. They're using alternative products, tea whiteners like soya milk and almond milk and things like that. Do you think these are alternative to dairy, and do they provide calcium?
If I'm honest, I mean, I don't recommend, for one of the reasons that either you take a healthy diet or supplement from elsewhere, then fine. But if you can't or you don't, then you are prone to have these things. So altered diet, if it does not contain the initial elements, which is calcium, vitamin D, and other minerals as well as vitamins, then you're prone to have these problems. So if you have an alternative or you take supplement, then you might save yourself.
Okay. Thank you very much, Dr. Asghar Bhayo, for joining me today.
Thank you very much for having me today.
I believe our viewers will find this information very useful. Thank you. Thanks, viewers, for watching this episode. If you found this useful, you can share with your family and friends. And if you haven't already, make sure to subscribe to this channel. Thanks for watching.